Ireland is facing a profound mental health crisis. While acknowledging the progress made in recent years, the Irish government requires significant structural and policy changes to effectively address this crisis, moving beyond reactive measures to a proactive, preventative, and comprehensively integrated approach. The inadequacy of the current system is multifaceted. Firstly, access to services is severely limited. Waiting lists for therapy, particularly for specialised treatments like cognitive behavioural therapy, are excessively long, often stretching for months or even years. This delay significantly impacts individuals' recovery and can exacerbate existing conditions, leading to further deterioration and even suicide. The geographical disparity in access is also a major concern, with rural communities disproportionately affected by a lack of readily available mental health professionals. Secondly, the current system lacks sufficient funding and resources. While increased investment has been promised, it often falls short of the actual needs. This underfunding translates into a shortage of qualified professionals, inadequate staffing levels in existing facilities, and a lack of investment in innovative treatment approaches. The result is a system perpetually struggling to cope with demand, leaving many individuals without the support they desperately need. The stigma surrounding mental health persists as a major barrier. Despite increased awareness campaigns, many individuals still hesitate to seek help due to fear of judgment or discrimination. This stigma extends beyond societal attitudes and permeates the healthcare system itself, potentially leading to inadequate care and a lack of empathy from healthcare providers. Addressing this requires a multi-pronged approach, including public awareness campaigns, training for healthcare professionals, and fostering a culture of open and honest discussion about mental health. The government's response to date has been largely reactive, focusing on addressing immediate needs rather than implementing long-term solutions. While initiatives like the National Mental Health Strategy have been commendable, they lack the necessary resources and systemic changes to make a truly impactful difference. A proactive approach is crucial, focusing on preventative measures such as early intervention programs in schools and communities, promoting mental well-being in the workplace, and addressing the root causes of mental health issues like poverty, inequality, and social isolation, as well as drug abuse. To effectively address the crisis, the Irish government must implement several key changes. This includes significantly increasing funding for mental health services, expanding the workforce of mental health professionals, particularly in underserved areas, and reducing waiting times for treatment. Furthermore, a comprehensive review of the current mental health system is necessary to identify inefficiencies and implement structural reforms. This should include a focus on integrating mental health services with primary care and other relevant services, ensuring a seamless and accessible pathway to care. Finally, a concerted effort is needed to tackle the stigma surrounding mental health. This requires a national campaign to promote understanding and empathy, coupled with training for healthcare professionals to ensure they are equipped to provide culturally sensitive and non-judgmental care. The government must also actively engage with community organisations and individuals with lived experience to ensure that policies are informed by the needs of those most affected. The mental health crisis in Ireland demands urgent and comprehensive action. The current system is inadequate and requires significant systemic change. Only through increased funding, workforce expansion, systemic reforms, and a concerted effort to address stigma can the Irish government effectively tackle this crisis and ensure that all citizens have access to the quality mental health services they deserve. Failure to act decisively will have devastating consequences for individuals, families, and society as a whole. On a more personal note, I'd say I'm like most of you watching. I think most of us have someone in our lives that the system has let down because they struggle with their mental health. There are countless mothers, fathers, brothers, sisters, and even children who have nowhere else to turn because the system has no more help to provide their loved ones who are struggling with mental health. Hopefully one day that can be different in this country. If you enjoyed this content, please hit the like button. And if you have someone in your life who's been affected by mental health and the government hasn't done enough to help them, please comment below. Also, if you're new here, please subscribe as most of my viewers are not subscribed. Thanks for watching. Stay tough.